Hi, I'm Kayla Borsato, and I'm about to do my informative speech. Here is my audience. I have my mom, our friend Beth, my future roommate Lauren, and my brother. Alright, let's see. Okay, so like I already said, my name is Kayla Borsato, and I'm here to teach you a little bit about heartworm disease in dogs. So, we're in the middle of summer, we're buying bug spray to protect ourselves from the mosquitoes, we're buying tiki torches, mosquito repellent, basically anything we can get our hands on to protect ourselves from the new Zika virus that the mosquitoes are carrying. But what are we doing to protect our dogs? So, mosquitoes are the only known vector for heartworms in dogs, and the American Heartworm Association has done these polls to see like what areas are most affected by heartworms. So you got they do tests every 3 years, so in 2007, 2010, and 2013. As you can see, the southeast region is the most highly impacted by heartworms. So it's important that we, especially here in Texas, have our dogs on preventatives so they don't get heartworms. If your dog is not on preventatives, an adult worm can live inside them for from 5 to 7 years. And I currently work at an animal hospital, and I get to run the heartworm tests, and more tests are popping up positive just because of the heat for the summer and all the wet weather that we've had lately. It's a prime time for mosquitoes. I'm going to tell you a little bit about what heartworms are, their life cycle, and what you can do to prevent or treat if your dog gets heartworms. So many pet owners are not too sure, they're not too informed about what heartworms are. The American Heartworm Association says that heartworms are these large worms that live inside your pet's heart, lungs, and associated blood vessels. And if they get heartworms and they're not treated correctly, they can end up causing permanent damage to those parts of their body. So it's important to start preventative early. You can start preventative, you want to start it no later than 8 weeks old, but if the package says you can start it earlier, it's safe to go ahead and do so because puppies are just as susceptible to heartworms as adult dogs are. And as well as our dogs, our cats and our ferrets can get infected as well. And the life cycle of a heartworm starts in an infected animal. A mosquito will bite the infected animal and carry the larva inside of it. It's like an intermediate host. The heartworms don't hurt the mosquito, but they use it to travel to a new host. And then once the mosquito bites your pet, it injects the larva under your pet's skin. And as long as your pet is on preventative, it will prevent the larva from developing any further. But if your pet is not on preventative, the larva will develop into adults, and then they'll develop into mature adults, and they'll be able to reproduce and make more worms until your dog's heart is full of worms. So some signs and symptoms so you know that your dog has heartworms. They'll have some coughing. They'll be reluctant to do any exercise, any like excessive movements and stuff. They'll be fatigued. Their hunger will go down, and they'll have some weight loss. Those worms, if not treated at that time, can move from the heart to the lungs, causing more damage. And then there's a life-threatening cardiovascular collapse that dogs can have called Cavill syndrome. And once your dog has reached that point, they're going to have labored breathing, the pale gums that you see right here, and they'll have dark, bloody urine. The only way to help your dog at that stage is to have a surgery to remove the worms from the heart at that time, or else it could be super fatal. So, in order to keep your pet healthy, you want to have your dog on prevention. If your dog does get heartworms, there's 2 common treatments that people like to use. There is ivermectin or miticide. Ivermectin is the oral tablet that you give your pet every week for 36 weeks. People like that because it is easy to give to your pet and you don't have to set up appointments at the doctor. You can just do it at home. But it's been proven to not be as effective. There's only a 20.3% reduction rate in the amount of worms that are in the heart. So the American Veterinary Medical Association recognizes the imiticide injections. There's 3 injections that you have to give. It's 100% effective. It'll reduce the amount of worms in your pet's heart, but you do have to set up an appointment at the vet to go and get those. So at my clinic, we do give HeartGuard for our prevention. We find that it's super effective, and our clients seem to respond to it pretty well. But it's important to know that the preventatives are not treatments. If your dog has heartworms and you give them the prevention, it could be fatal, so you don't want to do that. And make sure when you run out of your preventatives and before you get your new package, you do have your dog tested to make sure that they don't want heartworms, because we want to kind of prevent that from getting serious. So heartworms are a serious disease. It's important to know about them. Again, I cannot stress enough that prevention is key. It's the cheapest, easiest way to keep your dogs healthy. And so I hope you learned something from this, so that way you can keep your dogs happy and healthy and y'all can live worry-free lives. And that's why we're excited, and thank you very much.